Teak has been working with us for a couple of years. He's got a great experience in health and wellness, certainly a leader in that area at Huntsville Hospital, and has had some fantastic and exciting roles in the mobile medical. They've got a very extensive employee health and wellness solution. So, Teak, I'm going to turn it over to you.
All right. Thanks, Gavin. So I have been with the hospital now for 6 years, and I've got to do some really neat work. We are a local, not-for-profit, community-owned hospital in Huntsville, Alabama, which is North Alabama, close to the Tennessee state line. And we are a self-insured organization, and we use a company to kind of administer our claims. And we saw, between about 2012 to 2014, about a $10 million jump in about a 24-month period on what it cost us to insure our employees. We have always had some form of a health and wellness plan, or program, if you wanted to call it that. But as we saw this jump, we knew that we really needed to have kind of a strategic focus to revamp that current health and wellness program that we had. And I, along with about a dozen other folks, spent a year kind of benchmarking against the Googles and the Cleveland Clinics and the Vandys and UAB and other organizations that we felt like were leaders in health and wellness, and kind of analyze what they do well, and where are some gaps. And that got technology on the forefront of our minds, that we've got some really great services and pieces of a wellness program, but we are missing the technology conduit to kind of make everything work right and to allow our employees to be more productive, and to be able to work smarter versus harder. So I started my search on wellness-related technology companies, and came across U.S. Health Center online, and kind of reached out to them for a demo, and that's how our relationship began back in 2014. In the fall of 2014. So Huntsville Hospital, we've got about 10 hospitals within our health system, over 8,000 employees. We have, the way we wanted to roll this out is we said we need to come up with a health and wellness program that we are going to perfect and that we are going to lead by example. So our main hospital, we're going to get this thing implemented and roll it out. And so that's currently where our relationship started with U.S. Health Center, is helping us get this new program out. And our goal was to get our hospital on board and then be able to share this model with our affiliate hospitals and help them get online. And then once the affiliate hospitals have been able to get online, help them take this program out to their corporate markets, and expand our wellness offerings into the corporate area. Our main hospital has already done a pretty good job about that in Madison County, but we have affiliate hospitals in surrounding counties. We have been able to so far bring, just within 1 year of us coming online at the main hospital, one of our affiliate hospitals, Decatur Morgan, came online in October of this year. And we have a non-affiliated hospital that we were able to still point U.S. Health Center towards, that came to us for advice on who we should use, or who they should use. And so we have got them pointed to U.S. Health Center as well. We provide a myriad of services when it comes to the world of health and wellness. We have OCMED clinics, about 3 clinics across town. We have nurse practitioners or physicians that are planted at certain actual corporate locations. We have one of our bigger projects that we launched a couple years ago is that we actually have a near-site clinic that is staffed with a family physician and nursing and support staff that is for Huntsville Utilities, and for the Madison County employees as well as our Chamber of Commerce. So we've got our reach there, and we have another relationship, a corporate relationship that we're looking to roll out with the U.S. Health Center platform in February of this year that we're excited about. We've been able to do some technology integration. We are a health system that most of our service area up until this point is pretty local, so we use our staff to do a lot of the the labs and things of that nature, and we import it into the U.S. Health Center platform. So we're kind of opposite of a couple stories you've heard of, but now with some of our new corporate customers that have employees in outlying areas, we're going to be leaning on some of the lab services that you guys heard about earlier that Aurora utilizes. But we have an HL7 feed that we use to transmit that lab data, and so we were able to work with U.S. Health Center, and they actually implemented HL7 for ease of use. From our standpoint, we're very appreciative of them being flexible and kind of making that a priority last year. And they have been really good at helping us kind of customize some of our content and activity tracking as we've rolled out these programs. All right, so we kind of, like I said, launched our new health and wellness program in January of 2015. 8,000 employees based out of the Huntsville, North Alabama area. Of our total eligible, we had about a 52% participation, and 69% of our medical plan was on it. We introduced, as we rolled this out, a tiered insurance approach, and we wanted to be more of a participation-based program versus an outcomes-based program. But we had a couple of to-dos that we require for our employees. Our employees, they have to get their biometrics and labs done once a year and get online and take their HRA. And we've got some benchmarks depending on their score that, if they're a tobacco user, that we have requirements that they have to go through a smoking cessation or alternative standard. Same if their health risk score doesn't fall within a certain range. We have some disease management programs. One specifically deals with diabetes, and the other we've expanded into heart health, where we're focusing on blood pressure meds initially, and then moving to cholesterol meds hopefully in the near future. So our employees had now a option of being included in a lower insurance tier for participating in our health and wellness program, and as a result, this gives us more exposure to be able to uncover people that are dealing with chronic illness and disease in the pre-stages versus coming to us full-blown. So we do have some requirements. Ours are not as punitive as some other programs. We might kind of migrate towards that as we build in some critical mass, but right now that's kind of how ours works. If you do the couple steps that we're asking you for annually, and if you require disease management, if you go through those steps, then you're going to earn a lower rate. We use, I think, a good bit of the services that U.S. Health Center offers. We want to lead by example. So any other affiliate hospital that we want to roll this out to, or company, and says, well, how do you know that this stuff is good? Well, we can say, because we have it all, and we've implemented it and tested it and used ourselves, kind of as that teaching point and example. And that was very important to us, that we are standing behind and actually using what we're going out there for. So we use the personal health desktop, the health risk assessment, the coach tracker. Our coaches have been able to see, they've been able to work so much more harder, or smarter versus harder, by having some technology that has allowed them. We had a couple options. We could have hired more coaches, or we could have had technology that would help streamline their work. And by having this type of technology in place, we've been able to actually get more production out of our same number of employees. And as the program is growing, we are having to add some staff just mathematically to make sense. But we use the health counts. We have got our own laundry service for the hospital, where we had to utilize the paper portal aspect, which was a huge help for us. So we were very appreciative of the versatility there. And again, getting the HL7 interface for data integration implemented required a good degree of back-end work, and we were able to accomplish that, and weren't beat up too bad on a fee for service. So those are all aspects that we've really enjoyed working. So our next step, like I said, is to be able to expand what we are doing across the other hospitals that are in our health system, and then help them launch this out into their respective corporate markets, and point some of these ancillary services back at the hospital. So it has, for us has been a really great investment, and we have been very well supported by U.S. Health Center, and could not be doing half the stuff that we're doing without technology like this in place. Especially the data analytics on the back end is that's what a lot of people want to know. And here in Huntsville, Alabama, where our nickname is the Rocket City, we have the Redstone Arsenal, we have the Space and Rocket Center, we have one of the top 5 largest research parks in the world, and so we're a very tech-driven town. And the reality is, people look for stuff that's convenient, that's user-friendly, and that has the bells and whistles. And we were able to accomplish all that through this investment and partnership with U.S. Health Center.